How to care for a cat with a broken or injured tail. Cats are known for their agility and graceful movements, but accidents can still happen. One common accident in cats is a broken or injured tail. Tail injuries in cats can be caused by falls, being caught in a door, or getting their tail stepped on. Regardless of the cause, it is important for cat owners to know how to care for a cat with a broken or injured tail to ensure their pet's comfort and well-being. The first step in caring for a cat with a broken or injured tail is to assess the situation. If you suspect that your cat's tail is broken or injured, it is important to remain calm and act quickly. Gently examine the tail for any signs of obvious injury, such as bleeding, swelling, or an abnormal shape or position. If you notice any of these signs, it is best to seek veterinary attention immediately. A veterinarian will be able to properly diagnose the injury and recommend an appropriate course of treatment. If the injured tail doesn't appear to be severely damaged and your cat is not in visible distress, you can start by providing immediate first aid at home. The first step is to minimize the movement of the tail to prevent further injury. You can do this by carefully and gently securing the tail to your cat's body using a clean bandage or tape. Make sure not to wrap the bandage too tightly as it may restrict blood flow. Ideally, the bandage should be loose enough to allow movement but tight enough to provide support. Next, remove any potential sources of pain or irritation around the injured tail. If there are any objects or debris stuck in the fur, carefully remove them using a pair of clean tweezers. Be extremely gentle to avoid causing any additional discomfort or injury to your cat. Pain management is another crucial aspect of caring for a cat with a broken or injured tail. Cats in pain may become restless, irritable, or even aggressive. To alleviate their discomfort, you can administer over-the-counter pain relief medications specifically formulated for cats under the guidance of your vet. Never give your cat human pain medications as they can be toxic to felines. It is important to follow the dosage recommendations provided by your vet to ensure the safety of your cat. In addition to pain management, you should also provide a comfortable and stress-free environment for your cat to aid in their recovery. Create a calm and quiet space for your cat where they can rest and heal without being disturbed. Make sure to provide soft bedding and keep the area clean to prevent any infection. It is also important to monitor your cat's eating and drinking habits. If they show a decrease in appetite or thirst, it may be an indication of further underlying issues, and you should consult your vet immediately. During the recovery period, it is important to keep a close eye on your cat's tail for any signs of worsening or infection. Signs of infection include redness, swelling, discharge, or a foul smell. If you notice any of these signs, contact your vet for further instructions. They may prescribe antibiotics or recommend further medical intervention. As your cat's tail injury gradually heals, you can slowly allow more movement in the tail. However, it is still crucial to monitor their activity level and restrict any excessive jumping or climbing that could potentially re-injure the tail. Gradually increase their exercise and playtime as their tail continues to heal and regain strength. It is also important to be patient during the recovery process, as it may take several weeks for the injured tail to fully heal. In conclusion, caring for a cat with a broken or injured tail requires prompt action, proper first aid, pain management, and a calm and comfortable environment. It is important to seek veterinary attention for a proper diagnosis and treatment plan. By following these guidelines, you can ensure a smoother recovery process for your feline companion and help them regain full function of their tail.